This in the news.
New findings in the connection between your gut and your brain could hold the cure for those living on the spectrum.
Patients with autism tend to have chronic constipation and diarrhea, but when doctors take good bacteria derived from the stools of very healthy people and transfer them into the gut of someone with autism, they can help those gastrointestinal problems go away.
2 years after the study ended, the team found participants' GI issues were almost completely eliminated, and their autism symptoms reduced by nearly 50%.
Over time, it just seems their brain is much healthier. Now they're able to learn language, learn how to interact socially. They have fewer behavior problems.
Andrew's mom, Patricia, says her son can act more independently now. He's okay with changing a routine last minute, and he's learning to cope with sensory issues.
Ben, now a 7th grader, was able to transfer out of a special needs private school and into a general ed classroom.
The success isn't perfect, but it is across the board in the study. Look at this graph. It basically explains how parents report their children's happiness. You look at these dots, it shows that every single person in the study had improved symptoms and improved happiness.
Amazing, amazing. When we hear about, the investigation into autism and, Sanjay Gupta and all of these news leaders saying, there's huge work trying to figure out what's causing autism, what's going on with autism. Obviously, just so you know, it's reported now we've gone from 1 in 10,000 children to now 1 in 36 children being diagnosed with autism in the United States of America. This is an epidemic, and someone needs to figure out how to help these children. And so I think this is maybe some of the most exciting science going on in the world today. I've said it before, I am not anti-vaccine, I am pro-science. We should be following where the science leads us. This was the headline. It was published in Scientific Reports. Long-term benefit of microbiota transfer therapy on autism symptoms and gut microbiota. I am joined by Dr. James Adams from Arizona State University to discuss this incredible work. Dr. Adams, can you hear me?
Yes, I can, Del. Thank you.
Thank you for joining me. So, to begin with, how was this study designed? How did you perform this study? How many people were involved? Sort of what was the method?
We followed on by some important work by one of our collaborators, a gastroenterologist in Australia. He had treated 9 children with autism who had chronic GI problems, and he treated them with microbiota transplant. Unlike with C. diff, where one dose, one time, 90% cure rate, he found kids with autism were much harder to treat. So he treated them every day for 3 months and found that he was able to slowly, gradually improve their GI symptoms, and surprisingly, also found improvements in their autism symptoms. So with the help of Dr. Brody, we designed a clinical trial, phase 1 FDA-approved clinical trial, in which we treated 18 children with autism, and all of whom had chronic GI issues, chronic constipation, chronic diarrhea, or alternating between the two. We treated them first with a special antibiotic to kill off pathogenic bacteria, then a bowel cleanse like you'd have with a colonoscopy to remove any remaining bacteria. Then we treated them with microbiota transplant from healthy, carefully screened donors. We did that every day for 7 to 8 weeks. Slowly, gradually, the GI symptoms improved. 90% of our children had great improvements in GI symptoms. But surprisingly, there was also a slow, steady improvement in autism symptoms, about 25%. So we were really pleased with that. It's an open label study, so there's some placebo effect. So we were pleased with those results. We followed up 8 weeks later. We saw those results were still stable. But then I thought I was done. Great. But then a year later, a family came up to me and said, Professor Adams, my son's doing better than ever. Then another family came up and said the same thing. And their third family said the same thing. So I said, okay, we need to do a follow-up study. So 2 years after treatment stopped, we followed up with every one of the 18 participants in our study. None of them had dropped out. And what we found is that most of the GI benefits had continued. There was still about a 59% improvement compared to the start of the study.
Wow.
What was really interesting is almost all of the families said there was just a slow, steady improvement in autism symptoms. The children were just learning a little bit more each day, beginning to catch up to their peers. So at the end of 2 years, our professional evaluator evaluated the families and said there's about a 47% decrease in autism symptoms. Most of the children started the study with severe autism. At the end of the study, most of them had either mild to moderate autism or even below the cutoff for autism. They still had symptoms. They weren't completely cured, but they had made big improvements. So it's just very exciting to see.
Oh my God, I can't imagine as a scientist. I mean, first of all, this is one of the great quandaries of our time. And to be on the cutting edge and seeing, these types of results, I can't imagine what that's like for you as a scientist. I want to go back to a couple of things you said that I found curious. So you said it's an open label study, so therefore the placebo effect was in effect. What do you mean by that? I'm just curious what a placebo effect is in a study like this. Oh, did he lock up? Did we lose him? Hold on one second. Okay, we'll try and rejoin with him. I think it's fascinating, this idea that by treating the symptoms of the gut, that the mannerisms, the behaviors are improving. I think he said 47%. The question I was going to ask was the placebo effect. When we think about placebo effect, a lot of times we think about the fact that, people who are involved in a study, their belief system. Oh, so you're back. Okay, great. All right, great. So my question was, my understanding of a placebo effect is our belief in something working. I'm taking a drug, I believe it works. That has a placebo effect. For some group, they actually get better simply by having that belief. Is that what you're talking about with this study?
That's right. A placebo effect is significant for almost any study, but especially in autism studies where when you're faced with a potentially lifelong crippling disorder, there tends to be a very high placebo effect. And the questionnaires we use to assess autism symptoms rely a fair bit on the parents' response. But what we also did was we looked at the bacteria themselves in the gut. At the start of the study, kids with autism were missing hundreds of species of bacteria. A normal, healthy gut has of order 1,000 species. Children with autism were missing several hundred. At the end of our treatment, their diversity had normalized. 2 years later, they had better than average bacteria. So it was very exciting to see this good improvement in numbers of species, because in general, the more species you have, the healthier your gut, the better it is to digest your food and fight off bad bacteria.
So so what was the delivery system? I mean, we hear this term fecal transplants and things like that. It kind of gives you like an ooh factor, but did you use different approaches? I know that sometimes when we think of fecal transplants, you're dealing with C. diff, sometimes they deliver it anally, otherwise orally. What was the approach you used? Was one better than the other? How did you come to that determination?
Because we had to do it every day, we decided that we would do the first dose, some of the children receiving it through a deep rectal enema, but some of the children just swallowing it orally. We're using a highly purified form. This is not raw poop. This is highly purified, so it's 99% just gut bacteria, just like a probiotic that you would take from very healthy donors. So they would swallow it orally. When they took it orally, we also gave them a stomach acid suppressant, because your stomach acid will kill off most of the bacteria that you're exposed to. So by suppressing the stomach acid, most of the gut bacteria we were giving could make it into their intestines and multiply and grow there. And so what we found is that it didn't matter which way we gave it initially. Both groups had great improvements in GI symptoms, great improvements in autism symptoms.
Fascinating, fantastic. So now the next big question, because a lot of people right now, tens of thousands of people today, hundreds of thousands around the world will eventually watch this show who have children with autism. I am sure they're saying, how long till is this going to be available for my child to be able to, use this process? Since the numbers are so exciting, what is the future for the science, and how long are parents going to have to wait till it's available for them?
Yeah. So just like with blood products, the FDA has classified microbiota transplant as a biological substance that needs to go through FDA approval. And I think there are very good reasons for this. My mother got hepatitis C from a blood transfusion and died from it. And so we do need to be careful about the risk of infections from products. One of the things we do to make it very safe is, unlike with blood donations, where some blood products are pooled from hundreds or even thousands of donors, here we're just using one donor to donate to one person. So that makes it a lot safer. But to answer your question, we did a phase 1 study to demonstrate safety and also, surprisingly, some efficacy. We're now doing a phase 2 study, randomized, double-blind, placebo-controlled, and that's off to a good start. If that study goes well, then we still have to do a phase 3 study, same sort of thing, but just much larger, 10 to 20 sites around the country, maybe 500 people. If that goes well, then we can submit to the FDA for approval. What's exciting is the FDA has already given us fast track approval, that fast track status. And what that means is that they recognize that microbiota transplant is a promising, not proven, but promising treatment for an unmet need, mainly treating children with autism who have gut problems.
Wow, it's so exciting, and I think it's great when we see, so often we see issues with the FDA and CDC maybe aren't, doing the job correctly as we see it or the right way. But there is, I want to make it clear that there is a place. These things need to be safe. We can't just have everybody out trying everything. I imagine that there's going to be a huge, surge in people just on their own, naturally trying to do fecal transplants and things which could be dangerous. So I warn everybody, be careful. I think that it's really important that these things be done the right way with good doctors that are, that are staying within regulations, and there is a place for regulations. So I think that that's very exciting. I'm glad to hear that they're fast tracking it. I think that's very positive news to know that they see the benefit of this. All right, I was wondering if you could help me with another study, very similar. And I think what's so exciting is, there's multiple universities around the world that are really keying in on this gut biome connection to autism. There's another study that's come out, and this was the headline: Human gut microbiota from autism spectrum disorder promote behavioral symptoms in mice. So this appears to have been a study of mice that took place